half of the healthcare workers that are currently working are feeling burnt out. And when you consider the NICU space, this really just gets exaggerated, right? Because in the NICU setting, there's just a constant emotional and physical demand that our caretakers are experiencing because they are taking care of the most fragile and sickest babies, and they're in an environment that is constantly stressed, and which causes that compassion fatigue. And as we know, burnout is hugely impactful to your organization. It impacts job satisfaction. There's financial ramifications for burnout, but most importantly, it affects the quality of care that we provide to our babies. So this is a real statistic that we need to stay very focused on and figure out how to improve this. Continuous monitoring can really help reduce some of these pressures and these stresses that that your staff are experiencing in the NICU setting. So now I'm going to just take a brief moment to share a little bit of my experience with you. Christopher did a wonderful job of giving me a lovely introduction, but I wanted to share a little bit of a turning point, if you will, in my NICU bedside nurse career. I had been a bedside NICU nurse for about, oh gosh, a little over 10 years before I became a NICU mom myself. And I really felt like after a solid decade of being a NICU nurse in a very high acuity NICU setting, that I really had my feet under me and I really knew how to support my patient's family, and I just felt very confident in my skills. But having the opportunity to be on the other side of it and be the mom of a NICU baby, it really opened up my eyes and it transformed how I think and how I care, especially for the families in the NICU setting. And I wanted to share with you that as I was a mom, I realized just how difficult it was for me to bond with my son. My son is now sick, and so all of my ideas of what my birth process was going to look like are now shattered and changed, and I'm having to adjust to a very stressful situation. And there's a lot of unknown when he was sick, and so it really hampers my ability to bond. Also, he's hooked up to a monitor that gives me about, I don't know, 5 to 6 feet or so of tether to walk around and try to soothe and comfort and shush my baby, which was not a lot of room. I felt like the walls were closing in on me. It was just a really, really challenging time. And I think that it's really helped me to become a better nurse going through that, and to help others become a better nurse going through that lived experience, because I truly feel I have a better understanding of the stresses that the families are experiencing when they have their baby into the NICU setting. And so for those reasons, this is one of the pieces that really touches me about this body of work. And we're going to go into a little bit more detail around how this technology can really break down some of those super important barriers to allow the parents to effectively bond with their NICU baby. So next up, we're going to take a little bit of a dive into the science and the needs behind continuous monitoring. We're going to discuss a little bit about the gaps in care when you are doing spot check monitoring as opposed to the continuous monitoring. We're going to talk a little bit about the real-time insight that continuous monitoring provides for you. Okay, so this is what the NICU setting looks like, right? We know that spot checking is, for those of you that aren't familiar with the term, spot checking is referring to a technique where the nurse will just spot check or take a random sampling of the vital signs of the baby. So usually this is ordered every 3 hours or every 2 to 4 hours or something like that. So that's when the physician is saying, this kiddo is sick. We need you to gather vital signs on him and then try to track those vital signs to ensure that the patient is doing okay. So one of the issues with that is that's truly labor intensive. You're asking your nurse to add one more thing that they consistently have to do throughout their shift. It's also very disruptive to the baby, right? Like if you're not already in there doing cares or doing something else to support the baby, you're now interrupting some very valuable sleep to capture those vital signs, which can be very disruptive to the baby and their growth. Um, and it can also lead to missed trends. If you're only taking a brief snapshot of what your baby's vital signs are, you're really not seeing the entire clinical picture of what's going on with your baby. So continuous monitoring helps to reduce that manual workload, which is obviously a huge impactor of job satisfaction, right? It also helps to improve the safety in your NICU settings, and it allows your nurses to focus on other things. There are so many competing priorities in a NICU setting, whether you're talking about making sure that PT is done or giving your meds on time, making sure you are there to capture their emotional needs. When you're pulled in a million different directions, sometimes that means that a baby cries for longer than they should, and you're not there to support their emotional needs. So by having technology lean in and do some of this continuous monitoring for your nurse, it really frees them up to do other very, very important tasks that they need to do in their space. Next, we're going to talk a little bit about literature. Who's a clinician that doesn't love a little good literature to help support the mission here? So this first bit of literature really speaks to continuous monitoring as a standard of practice. So if you are not currently using continuous monitoring in your NICU setting, this literature is a must. And there you will find many, many more with a similar motto, if you will, which is that it is imperative to be using continuous monitoring in the NICU space. We must be able to continuously have eyes on what's going on with that kiddo. If there's a reason for them to be in the ICU, you really should have that monitoring in place. And being able to continuously monitor your patients will give you those very small changes that happen in your vital signs that allow you to predict some of these things that your babies are at risk for, such as sepsis or neck or brain injury, early identification of cardiopulmonary arrest, right? All of these things, vital signs, if you're continuously monitoring them, you're going to be able to notice those changes and be able to intervene much quicker. The second literature article here is pretty interesting, and it really speaks to those first couple hours after delivery. So what we call the recovery period of birth. And so this is usually a time when a healthy newborn is over in the labor and delivery space. The NICU nurse might come over for a high-risk delivery or whatever, but these kiddos are typically term and healthy and over in labor and delivery. But this article talks about how maybe we're thinking about this wrong, and maybe we need to be continuously monitoring these kids over in that space. We're doing vital signs very, very, very regularly anyway. One of the biggest barriers to that, again, is being tethered to a monitor, right? The mom is trying to be skin to skin, the mom is trying to bond, the mom is trying to breastfeed. So putting them on a monitor really creates a barrier to all of those things that a healthy newborn is trying to do with the mother during those first 2 hours after birth. But this literature article does give us opens our eyes to the fact that bad things really do happen to these babies very early on, and that really best practice would be to continuously monitor them during the recovery period. And then this is just more research supporting the continuous monitoring. These are just little blurbs, if you will, little highlights from some more literature out there that just highlights the importance of that continuous monitoring in the first hours or days of life, especially your heart rate and oxygen level. One of the things I thought was really interesting as I was digging into this literature is that, if you're very close to labor and delivery nurses, they'll tell you, I don't really want anything to do with the baby, especially if the baby's sick, right? They're very, very comfortable when the baby's inside mama, and they know exactly how to handle and support and manage the baby when the mom is pregnant. But once the baby comes out and things start to go bad, that's when labor nurses get really nervous. And so one of the things I love about this product is you can continuously monitor from the NICU. You could have a NICU nurse have eyes on this baby from afar. So you're really getting that expertise of a NICU nurse, and they don't have to sit in the labor and delivery unit. You're not having to remove a NICU nurse and put them into a labor and delivery unit to ensure that that baby has that level of expertise that would be ideal for that particular patient. Okay, so let's dig in. This slide here is going to talk to you a bit about the clinical study that was done on the Aulisa product, just to truly highlight the accuracy. Obviously, anytime we have new technology that comes out, we really need to vet it and ensure that this technology is accurate, and we can count on it. So we have done a study with the product, and the Aulisa pulse oximetry system has been validated for accuracy in infants through a clinical study. The study represents a breakthrough in vital sign monitoring, and the SpO2 accuracy was compared against a reference CO oximetry system. The sensors for adult, pediatric, and infant all passed the ARMS specifications of 3.0 under steady state or non-motion conditions for SpO2 ranges from 70 to 100%. So what this means is that you can rest assured that when you're getting a reading on the monitor, that it's accurate and it's reliable. Next slide, please. And then this I wanted to share with you. Aulisa really, truly is dedicated to bringing you the most up-to-date education there is out there, especially when it comes to monitoring. So they have an amazing resource that's available to us so that we can check and see what the most, it's just kind of right at our fingertips. We've got the latest evidence and research, and who doesn't love a free resource page, right? So I strongly recommend you clicking on this link. I think we're going to share it in the comments there. It really, really has been helpful, and I've definitely favorited it myself on my laptop just to be sure that I can reference it and check back on a regular basis to see what new research or literature they have out there. All right, so now let's dig into the clinical application in the NICU setting. So next we're going to discuss how the Aulisa Guardian Angel, which is the infant monitoring system, how it will provide that real-time data and alerts to your clinical team. And we're going to talk a little bit about the system support for both the clinical team and the families if you were to consider implementing this type of product into your NICU space. Okay, in just a minute, we're gonna play a video for you. But before watching the video, I want to try to pay attention a bit to the Guardian Angel's comprehensive support system. It's truly incredible technology that's very accurate and reliable. And I think the video would do a little bit of a better job at just explaining the ins and outs of the product. It's very intuitive. It really does provide peace of mind to not only your clinicians, but to your family. It provides that early detection, which I think is just imperative, which also allows that the team to rapidly respond to the patient. So let's go ahead and play this video for you.
Welcome to Aulisa Medical's FDA-cleared centralized multiple patient monitoring system, also called CMPM. Here is an overview of the CMPM information transmission process, making it easy to use in your healthcare facility. Did you know that we don't require software installation? Simply use your browser and log in on any computer to start using the CMPM system. You can now access a real-time display of your patient's vital signs, including blood oxygen saturation levels, heart rate, and temperature for up to 16 beds, each with customizable upper and lower alarm limits that are both audible and visual alerts. This allows your staff to monitor real-time alarms on the information display and manage multiple devices and patients simultaneously. This new standard of care provides real-time management of abnormal conditions for enhanced patient care. Plus, you can now download the exportable vital history data, your preferred format for easier research and analysis. We know that patient safety is your biggest priority. Allow the CMPM system to monitor even your tiniest patients in real time so you can keep your patients safe and provide greater peace of mind for caregivers. And rest assured, you won't need to worry about a thing. Our system provides secure, double encrypted, and customizable storage of patient data in the cloud or locally. We also pride ourselves on offering a customizable interface and integration to meet your facility's needs. To summarize, our CMPM system transforms patient care by providing the real-time data needed to keep your patients safe. So don't wait any longer. Get in touch with us today by visiting www.aulisa.com or contacting us at information@aulisa.com. We can't wait to hear from you.
Awesome. Thank you for that. So if you didn't catch it, this is a wireless continuous monitoring system for infants called the Guardian Angel, and it will track the heart rate, the oxygen level, and the body temperature in real time continuously on your babies. So one of the things that I really appreciate this product is that it eliminates the discomfort and risk associated with a traditional wired monitoring system. For those of you that currently work in a NICU space, you know skin integrity is one of our biggest concerns. These little kiddos can't tolerate a lot when it comes to skin integrity, and skin breakdown is a big concern. And so we're always doing things like straightening out the linens and making sure they're not laying on the cords and their IV line and things like that, because just that little bit of pressure can really start to break down their skin in no time. And that was one of the things I really enjoyed about this product is it's just that little bit of that pulse ox around their foot, and it's capturing all of that data, and you don't have to worry about the baby laying on cords or getting tangled up, because there are no cords. It's wireless, so it's wonderful for that as well. And it really is designed specifically for the NICU babies. So everything about the babies has been kept in mind, from the adhesive to, every aspect of it is really geared towards your NICU population. All right, so let's talk a little bit about the central monitoring system. So as mentioned in the video, with this product, you can monitor several patients all at once. But to me, that is obviously wonderful. But the thing that really got me excited about this is that you can customize it however you like. So in the NICUs that I've worked in, I may have, depending on the acuity of my kiddos, I may have 1 to 3 patients myself, and I may be buddied with another nurse, and I'm responsible for watching her kiddos if she is on a lunch break or whatever. So the beauty of this program is you can set up your monitor to what works for you. So instead of watching all of the babies in the NICU, you can set up your central monitoring system for just yours, or maybe yours and your buddy, or you can have it set up to watch the entire NICU. So I just loved the fact that it was completely customizable when you're using the central monitoring system. You also have the ability to customize it in different formats. So you can track and monitor your patients on a screen, maybe say at a nurse's station, or you can track it if a nurse wants it on her phone, because that's easier for her and she's going to be running all over the place or going to high-risk deliveries, often on the unit. She can have it on her phone. or on a tablet. So there are a lot of different ways that you can customize this to your clinician's preferences. The same thing with providers, respiratory therapists, so on and so forth. They can still have access to monitor their patients even when they're not at the nurse's station, which is really, really pretty impressive. So here is the login for, this is kind of the login page or the platform, if you will, that we use for the central monitoring system. And one of the things I wanted to mention on this is that Aulisa was kind enough to send me the product just to kind of check it out and get a good feel for the product. And of course, I was super excited to dig in and play with this product. And so I did. I dug in right away and way before my planned training. And I found that it was insanely intuitive. It was very, very easy to navigate through the system, even before I had had my formal training on the product. And so I think that's really important. I think anytime we change anything, especially as it pertains to technology, that can be a stressor on your facility. But having a product that is so easy to implement and very intuitive just makes that much better and that much easier. Yeah, I think that's all we need to say there. All right, moving along. So this is one of my other just absolute favorite features is the ability to see trends on this monitoring system. So you can detect early any kinds of changes, either visually or audibly. You can modify your alarms however you need to monitor for your patient needs. And sometimes we have babies that have a disease process or something going on that maybe we need to adjust their monitor limits a little bit. And so all of that is just, again, super intuitive, super easy to do on here so that you can customize it, not just for your nurse's preference or your clinician's preference, but also for the needs of the baby. Okay, and then next I want to talk to you a little bit about go into a little deeper dive around the trending feature of this monitoring system. So with the Aulisa Guardian product, you have the ability to trend your patient's vital signs. And this was a completely new and innovative piece to me that I just thought is really going to transform how we care and how we monitor and assess our patients. This is a tool that we haven't had before. And the beauty of this is it really allows us much earlier intervention, which also allows us to make informed decision making. And I just wanted to give you a very brief story that I had encountered while I was at a bedside not too long ago. So I had what we would call a primary care baby, which really what that means is when the baby was born, he was very, very, very sick, very premature. And so they anticipated his stay to be a very, very long stay. And when we have kiddos like that in the NICU, we often will assign a primary nurse that says, you're the primary nurse that's going to, every time you're on, you're going to care for this baby. And you're really going to be kind of a key component in this child's care and his advocacy and so on and so forth. And so I think he was about 5 months old or so, and I had been his primary nurse for all 5 months. And he was just about ready to go home. We were all getting excited. He was eating well. He was doing well. And I just got that hunch, that nurse hunch that something wasn't right. And it was just really small changes. And so I escalated my concerns to the physician. And, I told him about the vital sign changes and he says, nope, they're fine. They're within normal limits. And I said, they are within normal limits, but they have changed for him. I promise you they have changed for him. These are small changes that I'm noticing and there's something wrong with him. Like we need to do some labs. We need to escalate care here. And he said, no, I'm not going to order any labs. The vitals look fine. And then the vitals changed even a little more. And so I escalated again. And he said, no, they're still fine. They're within normal limits. Well, by the time we continued to escalate, Of course, that escalation process takes a lot of time, and the baby started to get into really big trouble, and ended up coding, and we were able to support him. But I really think if we had technology like this, where we're absolutely able to trend those very small changes, even though they are considered, quote, within normal limits, we can see how the patient is trending over time, and visibly be able to see those changes, those minor changes and trends. We can do what we're supposed to do and intervene early. And that would just be one more piece of data that I could have had to advocate for this patient, to say something isn't right. I don't know what it is yet, but something isn't right, and the vitals are telling us that. So just want to share that very brief story with you, and how I wished I had this technology with me on that day when I was trying to advocate for my patient.